Missouri, Mr. Bell, for his 5 minutes.
Thank you, Mr. Chair, Ranking Member, and our witnesses for being here today. The purpose of today's hearing is to discuss how technology can help reduce the future cost of healthcare. But I find this topic very ironic because we can't look forward to the future of healthcare while ignoring the challenges that Americans are facing now. The reality is that there are over 24 million Americans facing unaffordable health care with the pending expiration of the ACA premium tax credits. In Missouri alone, premium tax credits assist 95% of our marketplace enrollees. And so I heard a few comments that have me over here scratching my head. Mr. Jacobs, you said that the ACA has not met its stated objectives, and costs continue to rise faster, and there's a failure to control healthcare costs. You remember saying all that, right?
Yes.
So I want to use an analogy again. So would everyone agree that Social Security overall is a good thing? Any objections to that? Okay. So when Social Security was created in the 1930s, most women were excluded. Intermittent workers were excluded. Nearly half the workforce population was excluded. And then it gets really rich with black folks. 2/3 of African Americans were excluded, 70 to 80% in certain regions of African Americans were excluded. But over the years, Social Security was improved. And I would say mostly by Democrats, but there was some bipartisan efforts there throughout the years to improve it. So I think it's safe to say that there was a point in time Social Security was not necessarily effective and a good thing in supporting folks, a lot of folks who needed it, and it got better because folks worked at it. So it's befuddling to me when we talk about the ACA, when Republicans talk about how bad the ACA is. First, it's the best thing we got going right now. Yes, it could be improved, so let's improve it. And so let's talk about the history. I'm a data person. So in 2010, Republicans unanimously opposed the Affordable Care Act. We all know that. In 2000, and didn't offer any alternatives, right? No alternatives, just opposed it, every single Republican. 2011, as soon as Republicans retook control of the House, they voted to repeal the ACA. Remember the whole repeal and replace? We never got the replace idea, but that's a different subject. Every Republican voted to repeal it. 2012, Republicans unsuccessfully challenged the ACA in court. Now, was there any court filings that the Republicans championed to improve the ACA? No, just to repeal it. I got a lot here too. I'm gonna try to get it in here. In 2013, Republicans refused to fund the government without delaying or repealing the ACA. They didn't say, hey, we got some ways to improve it. We just want to repeal it. 2015, Republicans passed a bill repealing the ACA that was vetoed by President Obama. No help, no ways, suggestions to improve it. In 2017, days after taking office, President Trump canceled ACA enrollment outreach advertising during open enrollment. Ms. Tripoli, does that help get the word out and help get coverage for folks?
No.
In 2017, Republicans tried and failed to repeal the ACA again. In 2017, Republicans passed Donald Trump's tax plan gutting the ACA's individual coverage mandate. Notice there was no legislation to improve it, make it better for Americans. In 2017, the first Trump administration cut enrollment outreach funding by 90%. They didn't do anything to improve the ACA. So when we are 3 weeks away from the end of the year, in the middle of open enrollment season, and we are all still waiting for a vote to protect the American people. So again, I gotta ask, where is it? Where is this vote? Where is the help? Where is this plan? Where's the action to back up the promises and talking points? And so where's the evidence that you all truly care about the affordable access to health care for the American people? Because every single thing that we see is just to repeal what has done the best to control costs for Americans. Yes, it could be better, but Republicans got to work with us. Americans are screaming for relief with health care costs. And I appreciate some of the things that you're doing, particularly Mr. Worley in Missouri, but these are only layers of things that we need to improve healthcare costs, but we have to address these issues head on, and it's going to take Democrats and Republicans actually working together and stop playing politics and actually get in a room and do it. If you don't want to call it Obamacare, great. We'll call it something else. We can call it the Obama-Trump plan. I don't care. Let's just do what we can to work for the American people and bring the cost down. And right now, Republicans, since this act was implemented, have not given us one single plan to improve it or to help Americans address these issues. Thank you, and I yield back.